CDC Director Dr. Rochelle Walensky joins us now. Good morning to you, Dr. Walensky. We got a lot to sort out this morning. We heard the president say one thing, and you seemed to. Good morning to you, if we could call it a good morning. There's a lot going out in these COVID streets. You know, we heard the president say one thing about we didn't see this coming. We heard you seem to say that, yeah, we sort of knew. So if we knew that this was coming, why are we not better prepared? The lines are very long. You can't get a home test these days. What happened?
Yeah. Good morning, Gayle. So things are moving quickly, right? So about a week ago, we reported that we had about 3% of our sequences now representing Omicron, and now this week we're reporting up to 73%. So we've known about Omicron for a little less than a month now, and as we've been following it for the last several weeks, we have seen in countries that preceded us and other places doubling times of this virus of as quickly as 2 days or 1.5 days even. So as we started to learn about this just over the last couple of weeks, we have seen that what is happening here in the United States is mirrored what is happening in other countries. And that really was the motivation for the president's and the administration's work right now to increase surge capacity throughout hospitals, to increase capacity to do testing and access to testing, and then, of course, to increase access to vaccinations as well.
I know we've heard all that we need to do, and clearly people are not doing it. But I still want to go back to, it doesn't seem like we were prepared for this.
Yeah, you know, the administration has been doing a lot in testing, and we have a lot more work to do. We recognize that. We've invested $3 billion in rapid tests, and even yesterday the president announced another 500,000 rapid tests that will be distributed to people without otherwise having access. We have 20,000 sites that you can get a free PCR test, and even right now as we speak, we're scaling up rapid PCR testing, federal sites for PCR testing in places that have the highest demand, including New York.
Dr. Walensky, with all of these people testing positive these days and more positives expected in January, people are looking at that 10-day isolation period that's still in effect, even if you're vaccinated and boosted. Meanwhile, the UK has reduced it to 7 days. Delta CO wants a reduction here. We've heard one of our frequent guests, Dr. Ashish Jha, say to friends he recommends as little as 5 days. Could we see movement from the CDC on that quarantine period?
Yeah, it's a great question. We're actively examining those data now and doing some modeling analyses to assess that, and we anticipate that we'll have some updates soon.
Dr. Walensky, more than 1,000 children have died of COVID in the U.S. They currently make up a quarter of the cases. 90% of children aren't vaccinated. So a lot of parents like myself are trying to figure out how to navigate not just through the holidays, but also with school. So what do you think we should do? Should we gather with our friends and family? And do you believe schools should be shut down?
Right. So several things in there, Nate. First, the best way we can protect our children is to get them vaccinated. Children above the age of 5 are all eligible for vaccination, and we are really working to get our children vaccinated to protect them from disease. If your child is less than 5, the best way to protect them is to surround them with people who are vaccinated themselves, who are boosted themselves. In terms of the holiday, how do we do the holiday safely? Certainly you want to make sure that you're vaccinated and boosted if you're eligible, and that the people who you're gathering with are vaccinated and eligible as well. But I want to highlight one important piece, and that is people are talking about the plane rides and the train rides, and that's actually not where the real challenge is. How safe your holiday is really about how safe you are in the time leading up to the holiday.
Yeah, we all have the information. It's just a matter of what we do with the information. You've certainly put the message out there. Thank you, Dr. Rochelle Walensky. We'll see you again, I know.
Thank you so much, Kim. Indeed.